Peter Nangolo lives with hemophilia. For the last 27 years, he has had to make adjustments to his life to avoid the detriments that come with the disease. Nangolo struggled through school with this condition, and in the long run, it also determined what course and job he can or cannot do.
I knew from the start, I knew that if I don't study, I will not succeed in this life. I've resigned from so many jobs because of this. And worst of all, I developed arthritis, which I'm going to be operated soon, which damaged my knees so bad.
Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. Dr. Samuel Ntambi, a medical officer with Mulago Hospital and who volunteers with the Hemophilia Foundation, explains that the abnormality is passed on to the boys by their mothers. He says that girls rarely suffer from the disease.
It could be due to lack of some components in blood, which we call factors, because when they are missing, then one tends to bleed uncontrollably.
Dr. Ntambi says there should be more effort towards diagnosing the disease in health facilities, especially the government ones.
So to run only a factor test or assay, we call it a factor assay for that, in Uganda shillings is about 400,000. And we don't only do that test to reach at that level. There are some tests we do. A doctor has to examine a patient, assess whether really this is a true bleeding disorder. Then if he asks for the baseline tests, which are also costly.
Nangolo says he has not had difficulties in accessing treatment.
Because I get factor 8. Yeah, they infuse in the veins, and you get better.
We are depending on donors. So one day if the donors decide to stop giving us donation of factor, what will happen? It's important for the government to come on board, budget-wise, to help us buy the factor and identification of patients with hemophilia.
Uganda has no statistical data on hemophilia. Walter Mwesije, NTV.